Yes, I know. Dr. Jeff Newman from Newman Chiropractic. We're discussing football. We're putting out a stream of videos for you guys about the fall sports that are coming up. So what we want to touch on are the most common injuries, what I worry about most when I see your student athletes playing, because I try to hit up a couple games a year, and what I see in the office, and ultimately help your student athletes get better and be able to play and participate throughout the entire season. So when it comes to football, the first thing that we end up seeing is neck pain. And the reason that is because you haven't been wearing a helmet for the majority of the year, if not the entire year, and all of a sudden you get this helmet, you put it on your head, and then you're asked to run around and do all these activities that you haven't even been participating in for the last few months. So what ends up happening is the musculature in your neck becomes strained because you've added this excessive weight onto your skull. So instead of your skull weighing 10 pounds, it now all of a sudden has added weight to it. So people alone I see in the office all the time having neck pain from turning from side to side or any sort of neck range of motion type of activities. And now we're tossing an excessive weight to this skull, and we're surprised that people are having pain. I'm not. It makes perfect sense that your student athletes are having neck pain after tossing that helmet on. The second aspect that comes into the neck pain is the shoulder pads. The shoulder pads actually weigh down the shoulders. And a lot of kids these days, they breathe with their shoulders rather than their diaphragm. So you toss a helmet on the head, maybe if they have asthma or any sort of breathing condition, autoimmune wise, then they'll have difficulty breathing, and then they'll have neck pain along with it too. So a lot of the student athletes around that time start trying to crack their own neck, trying to get it mobile, because you're getting a lot of subtle straining in this neck stability musculature. When I played football in college, I know it seems a little odd, but we would come back from our practice during the beginning of the day. We would come back from our first practice and we would play video games for the next couple hours in between practices with our helmets on. And the rationale behind that was to get our necks used to always having that weight as a skull, right? So we were looking from side to side, moving around, doing our activities of daily living with that additional weight added to our head. So that's a little tidbit I give out to my student athletes that come in. If they can, bring the helmet home, wear it around the house. Don't eat dinner with it on, but wear it around, and you can end up noticing that your neck will be less strained and less irritated throughout the process. Now, along with the neck and at-home things that you can do, tummy time exercises are great. They're the first movement patterns that humans do to gain control of the weight of the skull. So that is laying on your belly, looking up, maybe you're watching TV or relaxing or even doing some stretching. You lay on your belly, lift the head up, and get used to lifting that head up. You do that about 10 to 20 times, 2 times a day. That'll be awesome. And then to end the day, always get some ice on that neck, because no doubt about it, that neck musculature is going to be surprised by the additional weight of the helmet along with the down pressure of the shoulder blades. So the least that you can do for your own safety and for your own body is to ice that neck towards the end of the day. All right, so what we do with our chiropractic treatment as the office is we use our soft tissue mobilization techniques and Graston techniques and potential adjustments to help make sure that all 7 bones in the neck are moving as ideally as they should. The second most common injury that we see with our student athletes is back pain with football. Typically, it can happen from getting hit, but the repetitive stress and wearing down of this back stability musculature actually takes place when you're down in your stance. Now the stance is hard for you guys to get into because you sit around for 7 hours a day. So, like I've said in many of my other videos, the fact that you sit for 7 hours a day and then practice for a couple hours and then sit again means that you're taking your seated spine position to your sport, which is always very dangerous because your seated spine position makes your spine very, very vulnerable. So what happens is we're supposed to be standing in this position here with a nice curve in the back. You guys sit all day and you're here with a flat back, making our back vulnerable. And then when you guys get in your stance, you guys get down like this. If you've ever heard your coach tell you, get your butt up, it's because your butt's tucked under in that seated spine position. The butt shouldn't be up like this, like most of us do. Our butt should be up like that. Okay, when we do this, we're able to reach down and our back is very stable and strong. And then when we hit someone, our back should be in this position as well. But it's very hard for the student athlete to notice this because intuitively, you guys sit like this all day. So when you get into your position like this, you guys have that flat, rounded back. What we want to do is we want to keep that curve there. That extension in that spine will really, really help you guys throughout the season. And lastly, Knee issues are huge with football. You guys are constantly getting impacted laterally in the knee, and that can be the quickest way to an end of the season for the student athlete. Now, believe it or not, the cure or the fix to your ACL strain or your knee strains actually lives in the hips and not the knee. And what I mean by that is that the knee is a hinge joint and it's meant to just bend. It's not meant to rotate. So if any rotational shearing force takes place in the knee, you're going to tear something, most likely the ACL. What actually is supposed to absorb the rotational force when something hits the knee is the hip. The hip is a ball and socket joint. If I get hit in the knee and my hip is too tight, my knee will do the twisting and I will tear something. But if I'm loose in the hip here, and if I run in the hips and I get hit in the knee here, rather than buckling like this, my hip will buckle and then I'll crumple down with the hip. You'll see this a lot if you're a parent. If you remember back to when your child was an infant, all the infants, they walk around like this, and if you hit them in the knee, their knees will buckle and they'll fall down on their butt. Infants and your student athlete, we're the same human. We're just a little tighter in a couple different areas because of the positions that we've been sitting in and moving in for the duration of our lives. So what we work on with our knee pain patients is we'll always work on the strain tissue in the knee, but we work really hard on getting your student athlete used to being very mobile in the hips so that the hips buckle instead of the knee when hit. Okay? Hope these are helpful, and stay tuned for more.